Hong Kong reports its first death from the novel coronavirus. Macau shuts all casinos for 2 weeks to curb the spread of the virus. The move came as the former Portuguese colony confirmed its 10th case of the virus. And the death toll in China increases by 64 in a single day. It's the largest jump in a day. The number of deaths now stands at 425. There are now over 20,000 confirmed cases of the novel coronavirus in China. And for more analysis on the situation, joined by Dr. Connor Bamford, a virologist and a Wellcome ISSF Early Career Research Fellow from Queen's University in Belfast. Firstly, Dr. Bamford, neighbouring countries are shutting down their borders with China. From a scientific point of view, is that necessary or are they overreacting?
So this is a really serious disease and a really serious outbreak, and we know this virus can infect people and it can even kill them, but importantly it can be transmitted, and it can even be transmitted while you're experiencing mild symptoms. We've got no vaccine and no antiviral, so really prevention is the best. And because it's hard to find those who might be infected and capable of spreading, you really need these drastic sort of isolation measures, such as blocking transport. And we know that it started in China, in particular this Hubei province, and China has stopped movement between, or within and between its own cities. But outside of China, we know these cases can appear, and because it's hard to tell who's infected and who isn't, one strategy would be to close immigration between that. But of course, that can have negative effects in dealing with the response and actually politically and economically.
Dr. Bamford, from what we know so far, what is the true extent, do you believe, of this coronavirus? How far can this go?
So I think, we have these confirmed numbers to go by, in the 20,000 confirmed cases, the 2,000 severe, and the nearly 400 deaths. We know it's spread outside of China. It's spread to 23 different countries. And even in those places, it's started to spread between people. And we've seen deaths in the Philippines and in Hong Kong. I think we have a good idea of the numbers outside of China. I don't believe that they will likely change drastically from importations from China, but it becomes very hard to know what is the true extent within China, because often, because there's so many cases, it can really overwhelm public health responses. So it's very difficult to accurately measure, but undoubtedly it's much higher than the 20,000 confirmed cases. And how far could it go? We know this virus can infect anybody. We know, although people who are older and maybe people who are sicker are more likely to get serious disease, and it can be easily transmitted between people. And if nothing's done, this could spread across the world as a potential pandemic and possibly even become permanently embedded in the human population. But of course, things are being done, and I think we are well prepared to successfully stop this a pandemic from occurring. But it will take a lot of time and effort and money.
It's not the first one we've seen. We know of MERS and SARS in the past as well. Do you think similar widespread infections could become more frequent in the future?
Undoubtedly. So this is the third new human coronavirus in the last 20 years. You mentioned SARS and MERS. And typically these viruses don't just come into existence out of nowhere, that they come from animals. And similar to avian influenza that we've all heard about, bird flu. And as the human population gets bigger and we go into more contact with animals, either this is directly from feeding on them, or environmental changes driving differences in sort of animal behavior. I would predict we're going to see more of these. And also with technology, we're much better able to detect these outbreaks if they are occurring. So it is quite difficult to compare now to maybe a couple of decades ago. And ultimately, I think we really need to find new ways to predict and prevent these outbreaks from occurring just in the first place.
Dr. Bamford, you mentioned the use of technology and that it might be able to help us with future outbreaks, or perhaps to prevent them or to understand more about them before they become a problem. Thus far, there's been so much speculation about the origins of this particular coronavirus. How can we adequately prevent or protect against future outbreaks like this?
So one of the ways at the minute, we need to deal, for this outbreak, we need to deal with just how it's transmitting in the human population. But we know these things come from animals, and the best way to do it is stop it at that, because it frequently comes from only a single or maybe a couple of events. But we have to understand where these viruses are and how they're getting into the human population. So we know that the coronaviruses are quite likely coming from bats, but we don't know how they get from bats to humans. So if you understand what takes place in the middle, you should be able to sort of educate people and possibly stop it from occurring in the future. And of course, we need better ways to diagnose new infections. So typically, it's very hard to diagnose a virus that we don't know that even exists. So we need new technologies to do that. And of course, vaccines and antivirals are the best tools we have to stop viral infections. Think of the flu vaccine and think of the MMR for measles and mumps. But again, it's very quickly, it's very hard to do this about a virus we don't actually know a lot about.
Dr. Bamford, thank you very much for that perspective. Thank you for joining us. That was Dr. Connor Bamford, Wellcome ISSF Early Career Research Fellow at the Queen's University in Belfast.